हेलो एंड वेलकम डियर स्टूडेंट्स। जैसा कि आप सब लोग जानते हैं कि आलमी नासाज हालातों की वजह से हम अभी अपने क्लासेस वगैरह कुछ कंटिन्यू नहीं कर पा रहे हैं, लेकिन ऐसे हालातों में भी हमने एक इनिशिएटिव लिया है ताकि हमारे बच्चे जो हैं वो सफ़र ना करें। तो ब्रीफली हमने पीपीटी क्लासेस शुरू करे हैं। तो इस सिलसिले में आपका जो टॉपिक हमने आज सिलेक्ट किया है आपके लिए, वो सेक्सुअली ट्रांसमिटेड डिजीज़ है। Sexually transmitted disease, actually these are the set of diseases, or we can say a group of diseases which are there, or which are, rather we can say, they are communicable diseases which transmit from a person to person by means of sexual contacts, though they can be transmitted through other contacts as well, but majority of them, major cause for their communicability is due to sexual contact. Some communicable diseases which are commonly found in humans are Chlamydia, Gonorrhea, syphilis, Trichomoniasis, Fibulitis, genital herpes, genital warts. So let's discuss Chlamydia. It is actually a bacterial infection which is caused by a bacteria, Chlamydia trichomatis, which affects both males as well as females in their reproductive region. It occurs throughout the world, and large number of cases occur there and is more prevalent among females than in males. It spreads through unprotected oral coitus, vaginal coitus, or anal coitus, where it affects mostly women than men. The disease which occurs due to it, some of the persons in which this bacterium is found are asymptomatic. That means they doesn't show any visible symptoms. Among them, 70% are females and 10% are males. Symptoms generally appear within few weeks, usually 3 weeks of infection. What are the symptoms now? Female symptoms. It includes vaginal discharge, but it cannot be misunderstood with leukorrhea, which is also a vaginal discharge, but it's different from that. Or there may be burning with urination. That is, at the time of urination, there is the burning sensation in the vaginal region. Lower abdominal pain is there. Low grade fever. In males, there is a discharge from pins, and the same burning sensation as in females is also sometimes found in males. Burning and itching around the opening of pins, that's in the glans region, and pain and swelling in testicles. They also have low grade fever. It can be treated by any broad spectrum antibiotic, which includes azithromycin, cefixime, erythromycin, amoxicillin, doxycycline. Then the next one is gonorrhea. It is actually caused by a bacterium which is a bacillus bacteria, Neisseria gonorrhea. It is a bacterial infection which affects the mucous membrane mainly in the urethra and in the genital tract, along with genital enteritis. Spreads through unprotected oral, vaginal, or anal sex. Also spreads from mother to child while having vaginal delivery. So, for the practical reasons, a female having gonorrhea is advised to go through C-section if she is suffering from gonorrhea. The symptoms in males includes discharge from pins, it's somewhat sticky discharge, painful urination. 50% of females with gonorrhea have no symptoms, while 50% have vaginal discharge or pain or burning when urinating. The initial treatment consists of any recent cephalosporin, example ceftriaxone, cefpodoxime, and also given with a combination of azithromycin and doxycycline. The infants born from the mother having gonorrhea are always treated with silver nitrate, erythromycin, ciprofloxacin, gentamicin, or erythromycin eye drops so as to prevent the growth of bacteria Neisseria gonorrhea in their eyes, which may later on lead to blindness. Then there is syphilis. It is caused by a bacterium Treponema pallidum. It attacks many parts of the body and is caused by bacterium spirochete. It is transmitted through oral, vaginal, or anal unprotected sexual contacts. The sores which occur on the external genitalia, vagina, anus, or rectum, and can occur on lips and on mouth as well. There are few stages of syphilis which are known as primary stage, in which a chancre appears on the mucous membrane of the genital tract, oral cavity, or rectal mucosa in those having the anal sex. And the form of chancre, it is small ulceration at the site of inoculation. It persists for 4 to 6 weeks and heals even without treatment. If the person in the primary syphilis is not treated, it enters into the secondary stage known as secondary syphilic stage, which is characterized by systematic infection with skin rashes and enlarged lymph nodes. It begins several months after chancre has healed and persists for several weeks, then subsides without treatment. Okay, if If the person is left untreated, it enters into the stage known as tertiary syphilic stage, which is characterized by the destructive lesions in the internal organs. The syphilis can be transmitted from a mother to a child while having pregnancy and may cause death to the fetus. And the treatment of syphilis involves penicillin, and other antibiotics like doxycycline, tetracycline, ceftriaxone, and azithromycin. There are some preventive measures which can be kept in mind so as to get prevented from these dreadful diseases. These includes safe sex, that means having a protective sex with condom, which may help with the transmission of the diseases. Then there is a viral disease known as genital herpes. Genital herpes is actually a viral disease which is caused by herpes simplex type 2 virus. It is incurable. There is no vaccine to treat genital herpes. It, it is characterized by the presence of blisters and ulcers. Actually, the herpes infection is of two types. That is, that type of herpes infection which infects only the oral mucous membrane is the type first. It infects, or this type of herpes virus is found in those which are having oral sex. And the infected genital tract, that means the mucous membrane or the external epithelium lining of the genital tracts in these individuals is affected. Transmission occurs usually through vaginal, oral, or anal sex, and the transmission of virus can also occur through fingers. Most of the common symptoms is blisters. The primary outbreak occurs within a few weeks of contact. That means after an human is infected with the virus, it may take few weeks to show symptoms. Okay, then they may continue for a couple of weeks and may feel painful and itchy burning. There are some flu-like symptoms like as headache, fever, swollen lymph nodes, muscles, muscular aches, etc., and burning during urination. Treatment: symptoms are treatable only as it is an viral infection and no vaccine has been made for this type of virus, that means herpes simplex virus. So we can treat an individual symptomatically, that means the symptoms are treated, not the actual cause of the disease can be treated at this stage. So there are some antiretroviral drugs, example acyclovir, famiciclovir, valacyclovir, and the affected. Along with these drugs, there is a precautionary measure, that means the affected area should be kept clean and the hands should be washed and prevented from infection. Okay, here you can see the blister-like appearances in the organism or in the human having genital herpes. Okay, then there are genital warts. Genital warts are actually warts which are present in the genital region. These are different from those warts which are present on the rest parts of the body, and these are caused by the virus known as human papilloma virus. It is different from that which causes the rest warts on the body. Human papilloma virus are actually a group of viruses which have almost 200 plus strains. There are 40 above human papilloma virus forms that can be sexually transmitted. The warts which are formed or which occur after the human papilloma virus is found inside the body are pinkish or reddish warts. It is transmitted through vaginal, oral, and anal sex. Warts may cause itching, burning, and some pain. Approximately 30 of the human papillomavirus strains cause cervical cancer. Human papillomavirus also increase the risk of vulvar, anal, penile, or oral cancer. The penile and anal cancer occurs in those men which are homosexual. Genital warts may disappear on their own, or the topical ointments or creams are provided by the physician. The treatment prescribed by prescription medicine includes podoflox, which is actually a herb derived from a herb known as podophyllin. It is for external warts to stop the wart cells from growing. Then there is imiquide. It is actually a anti-mitotic which stops the cell division, does not allow the cells to undergo mitosis, so decreases the size of cells or the cellular mass so that the wart may not separate over a large area. Boosts the body's immune system so that it can fight human papillomavirus. Green tea extract, it's also known as syncathecins. These are actually the ointments for external warts. Interferons, these are the antiviral medicines which may be injected into the wart. Okay, then there are the procedures by which the warts can be removed, which are done by experts, dermatologists. A dermatologist can perform this by cryosurgery. That means there is the use of liquid nitrogen so as to freeze up the wart and get removed, and excision is then made so as to cut the wart from the body. Then there is electrocautery, destroys the warts with electric current. Laser treatments are there which destroys the warts with laser lights. And also one of the most important thing, that is the prevention. The most valuable method to avoid such diseases is preventive measures, and first one is refrain from sexual contact until the warts are gone. Second one is condoms may be helpful in the transmission of human papilloma virus. Then there are human papilloma virus vaccines which are not actually the vaccines which can destroy the human papilloma virus. These are actually the vaccines which help us to slow down their mitotic activities or their replication. Okay, see, these are actually the warts which are there found there in humans in the genital regions. Then there is trichomoniasis. It is actually a parasitic infection which is caused by Trichomonas vaginalis. It is also sometimes known as trich. It is actually a parasite that can be passed from person to person during sexual intercourse, and it occurs in the vagina of woman. Trichomonas is common cause of vaginitis, which is a second type of infection found in females, and it can be transmitted to a baby during delivery. It also occurs in the urethra of men with no symptoms. Usually, the symptoms in females includes itching and burning at the opening, that is the vaginal introitus, and vulva, painful and frequent urination, heavy, unpleasant smelling greenish yellow discharge, but not to be confused with leukorrhea. Okay, male symptoms. The male symptoms usually are nothing, are discomfort in urethra, inflamed head of pins, that is gland pins. The treatments involves any antiparasitic, usually metronidazole. It is an oral antibiotic. Prevention: safe sex, protected sex with a partner using male or female condom. Pubic lice. It's also caused by a parasite, ectoparasite rather, we can say, which is known as Pithyrus pubis. It is a curable disease. Pubic lices are also called crabes because they look like crabes in their appearance. They are tiny insects that can crawl from the pubic hair of one person to the other person. They usually attack the sexual pubic areas of the body and are found under arms, eyelashes, mustaches. They can separate through direct physical contact or close body contact with the infected person. Symptoms: persisting itching in the genital rectal region. The decontam- treatment involves decontaminating yourself, your clothes, and your bedding. Medication includes malathion, it is actually a topical lotion, ivermectin, 2 pills, oral dose. It is actually an antiparasitic which are also given to the persons having the endoparasites also, like as ascariasis, etc. Linden, it's toxic to lice, so it stops their separation. Prevention: avoid sharing clothes, bedding, or towels with anyone having pubic lice. Sexual contact avoided until treatment is complete and successful. See, these are the pubic lice. Okay, this is all for today. Have a nice day.